Assalamu alaikum. Welcome back to my channel. Today we are going to talk about physics and the applications and practice. Imagine when you are scanning and you notice a VSD as we have in this case, and the basic principle of ultrasound physics and this direction object which view is the best for measuring the diameter of this defect that we have here. As you know, one of our job here is to measuring the diameter of the defect. When we have VSD or any shunts, so tell me which view is the best for measuring the diameter of this defect. Parasternal long axis view, apical view, subcostal view, which one and why? Okay, for answering to the questions, first we study the resolution. What is resolutions? Resolution is the ability to separate and differentiate two cardiac structures that are located close to each other as much as the real structure. We have three types of the resolutions: temporal resolutions, axial resolutions, and lateral resolutions. Temporal temporal resolution is the ability to detect two structures that are moving close together and differentiate it. This is very important in echo and it depends on the frame rate. Axial resolution is the ability to differentiate two structures that are located one below the other or top or bottom each other. As you see in this, look at the axial uh, top or bottom of each other, the white dot. And related to the sound wave parallel, the arrangement are aligned parallel. As you see, these are the parallel. So when we have two objects, when we have two objects top or bottom to the sound waves parallel, the distance between them is meaning we are measuring are the machine capability to axial resolutions. The lateral resolution, when two structures are side by side, as you see here, the lateral resolution, the two structure is side by side, or another word perpendicular to the sound waves and direction. As you know, all the ultrasound machine in the best quality, they have these numbers for resolutions. The axial resolution is 0.1 to 1 mm and the lateral resolution is 2 to 3 mm by the distance. So based on this, you can say axial resolution in almost all kind of echo machines has the best resolution. Why? Because if two structures are close, even 1 mm separate from other, still machine can detect them, show those two objects and particles separately. And lateral resolutions is about 2 mm. So if those two structures are close then 2 mm to each other, the machine doesn't show separately, it shows one structure. Let's see on the schematic imagine we are scanning two particles differentiate that are separate 1 mm and align up perpendicular to the sound waves as 1 mm or 1.5 mm. And you know the best machine have the lateral resolution is about 2 mm. Since the difference between them is less than 2 mm, a lateral resolution of the machine shows us the picture is one entity. As you see, the lateral resolution is about 2 mm and the structure is far away from each other is 1 mm. So you see the red dot space, the place. This shows us as one structure. There is not any separation in one entity in this shape, but reality there are two separate structures and they have distance between 1 mm. Now we have two structure. Take it a septum here. Now we have two structure. Take it a septum here, and we are scanning lateral resolution this way. So here the machine use lateral resolution and the imaging here is 1.5 millimeter is the size of this defect. Since this is lateral resolution, the two particles line up perpendicular to the sound waves. The machine does not show any defect. They put both of them close and contact with each other as show single particle. Because the lateral resolution is 2 mm and the defect is 1.5 mm, so very easy go to axial resolution for the structure we can get better. There is almost we see a contact structure, not not separate, but only we see by the color flow. This schematic imaging, the right side is the lateral resolution and the left side is the axial resolutions. So we have the axial resolution here in a good machine is 1 mm and the defect size is more than 1 mm, so it shows separately the size and two particles separate up from one another. Look at this image of the axial resolution. In the apical view, you will clearly see the space between the septums in VSD. In the plex view, you cannot see the space but only by the color Doppler. But here in the axial resolution, which is 1 mm and the defect is more than 1 mm, and this is 1.5 mm, so you can clearly see by visual and you can measure the diameter here accurately. So based on this, you can guess the best way for answering that question is what and why. This is apical window. You can see this is apical window. You can see clearly the defect compared to the plex where you can not seen clear the defect and you can not measure the defect size. But this apical 4 or 5 chamber you can see very clear the defect size and preset and measure the defect diameter very easy. That is the reason for measuring on all shunts try to use axial resolutions. I hope I will clear you on this topic. Please give me feedback and see you next time.